And I couldn't sit back and watch another person, die from this without being on the front lines to help.
It's also hard to discuss with family the what ifs if you don't come back.
I'm leading a New York City humanitarian deployment trip here to be able to help in the COVID crisis.
If you don't have a healthcare crisis in your community, please come help us in New York now.
So we put out a request to our staff in Ithaca. It was a voluntary request to see if there would be interest to join our humanitarian trip. And within about 48 hours, we had over 100 people who are interested in coming down to New York. We were so warmed by the response that we received from the Ithaca community in regards to our trip. So we brought over 50 healthcare professionals here to New York, and we're working with New York Presbyterian, Weill Cornell. So we estimate that we'll be here until about May 7th. So we wanted to have a 30-day deployment.
We got a day or two of orientation, and it was quick orientation, but I dare say it was much more than any of these NYP nurses got when they first jumped into this. And at least we have people coming to us who already know a little bit about it anyway. I can't imagine what it was like going in blind. My wife, she knew that I was going to choose this because she says that's just who I am. She was very proud of me, but also felt like she was sending me to my death. And that's hard to hear.
I have a family back home that I have a really amazing husband who has been able to keep our girls, who are 8 and 6, entertained, and has been an amazing support person. The other really amazing opportunity I've had is that I also have a 21-year-old son who was able to come on the trip with me and provide nursing support. So to be able to watch him grow in this environment and take such genuine emotions and experience away from this and be a part of that is also really near and dear to my heart.
As far as what I've seen here, I've been very, very surprised with the patients I've seen. I've seen young, I've seen old, I've seen presumably healthy before this and very sick before this. The variety of people this disease affects is unprecedented. I have never seen anything like it.
But other patients I have watched crash and crash quickly, which is the case with most of the COVID patients. You don't have the time to go through all of the 9 or 10 steps that you might try to help stabilize somebody respiratory-wise, which is why patients end up sometimes getting intubated because you only have the time for the 4 or 5 steps.
I've had several instances where I'm really brought back to reality where I see, a patient's wedding band in a Ziploc bag on their whiteboard. And I'm like, this is someone's spouse, their partner, their loved one. And how can this happen?
Felt like for a long time, several weeks, we've been preparing for this onslaught of COVID patients, and luckily our area isn't one that has been devastated like Stony Brook has. I had a quick conversation with my husband. I asked him to ask our children, because I was working that day, what they felt and if it was okay with them, and they gave me the go-ahead, so I jumped on it. I will say that everybody has been so gracious, and all the staff here are so grateful that we're here to help. I was anticipating being busy, but I was not quite anticipating the way it is. Busy was kind of an understatement. The assignments that the nurses had were nothing that you would get on a normal basis. There just wasn't enough staff. I mean, they had their regular medical ICU, and then they had, which is where I'm located, and then they have 4 or 5 other makeshift MICUs, just because they had so many patients. And there's no visitors allowed, just like as in most facilities in the United States right now. And so what they do, anytime a patient is discharged, a COVID patient is discharged, they play like a little snippet of Here Comes the Sun on the loudspeaker. And so throughout the day, you end up kind of hearing the whole entire song.
Nurses are here to provide more than physical support. We're here to provide each patient with love and support and gentle reminders about how much we care. And I hope that the people sitting at home know that their loved ones are being cared for and they're loved by the staff here at the hospital. We will be there to hold their hands through the toughest of times until you guys are able to hold them again.
What I want to assure you as nurses is that we're doing our absolute best. We're holding their hand whenever we can. We are talking and giving them our love with each time we go in the room, with each gesture we make, and we are fighting for them. We're fighting for you.